Ebola virus is most likely to arrive in the United States via an infected person flying from West Africa who doesn't even realize he or she is carrying the disease. Ebola can incubate in a person's body anywhere from 2 days to 3 weeks before symptoms emerge. During this time, the patient isn't contagious. Even when the patient starts showing symptoms, the disease isn't especially easy to transmit. Ebola doesn't spread through the air, and it's harder to catch than things like the flu. You can't get it just from being on the same plane, or in the same public space. The only way to get Ebola is to touch a patient's bodily fluids, like vomit, diarrhea, sweat, saliva, or blood. At this point, it's important to identify the disease as Ebola quickly, and public awareness can play a big role. A patient traveling from Africa with flu-like symptoms is a prime suspect. If health workers realize that this might be Ebola early on, other people should be able to avoid getting infected by keeping away from the patient's bodily fluids. Unfortunately, in West Africa, Ebola had spread for 3 months before anyone actually identified the disease, which is partly why the disease was able to affect so many people. In US hospitals, any suspected case of Ebola should be treated as a potential risk until tests come back negative. The CDC has said that the patient in Texas, who has by now tested positive, is in strict isolation, which is exactly what needs to happen. Standard procedures to protect other patients and healthcare workers from the patient's bodily fluids will also be put into place. Because Ebola doesn't hang out in the air, hospital workers won't necessarily have to wear respirators, or what you might think of as full outbreak gear. However, they will protect their body and face from fluids that might splash on them, using things like gowns or full body suits, masks, gloves, and goggles. Anything that touches the patient will be sterilized or disposed of in a safe manner. And if the patient dies, the body will be carefully handled, so that it won't be a danger to anyone other. The death rate for the current outbreak is roughly 50%, although good healthcare in the US might lead to better outcomes than that. Experts will interview the patient's relatives, and other potential close contacts to monitor them and make sure that they don't spread the disease to others if they have it. Officials will then suggest various options for these people, depending on the level of risk, including watching and waiting, isolation at home, and testing for infection. The best case scenario is that someone coming back from West Africa realizes that they might possibly have Ebola as soon as they start feeling sick. Everyone makes sure not to touch this person's vomit, sweat, diarrhea, or other fluids, and the outbreak ends with just one patient. The worst case scenario is that this person is ill for days, and in contact with a whole lot of people, before anyone realizes that something unusual is going on, and brings this person to a hospital. But it's still unlikely that Ebola will get farther than a local problem in one city or town.